All right, let's see. All right, is my mic working? Let's see. Um, I hope that everything is working. If you guys can't hear me, you guys can type in chat. Hi, I'm Anna, a transgender woman, and I'm going to be quick talking about my experience going through a medical emergency for my mental health. So, a little bit of background about me. I am a EMS worker. I am an emergency medical technician with Mayo Clinic, based in the Duluth Superior area. And one of the hardest things about being a member of an ambulance service or working in the emergency room is the stigma of going and seeking help for emergency conditions that aren't typical. So, your typical medical emergency that people think of is a broken bone, major trauma, cardiac arrest, things like that. And something that not a lot of people talk about is the mental health emergencies and how critical and important those can also be to people. And as a EMS worker myself, it is super stigmatizing to go and seek help for your mental health. That's just a little bit of background about me. So, about 2 weeks ago, I needed extreme serious help. I had extreme increased suicidal ideation. Um, I had thoughts of self-harm, intrusive thoughts, hallucinations, the whole 9 yards. And my crisis was such a challenging struggle for me that I had to get over my stigma and get over that hurdle of seeking help and asking for um, some sort of assistance in dealing with that. I've been going to outpatient therapy for about over a year now. I recently started outpatient psychiatry as well. So I've got medications under control. I've got therapy, and I've got a lot of resources that don't require emergency medical intervention. However, when you are dealing with something that is so out of your control, for example, if you are dealing with a increased suicidal ideation, intrusive thoughts of self-harm, and your coping mechanisms don't help you, that can lead to some serious complications for your own mental health and for your physical being. So, I originally asked for help from my outpatient sources. I was diagnosed with PTSD. I had a traumatic event that made me relive some trauma, sexual assault, and rape that I had when I was a young girl. And um, that trauma and that PTSD that I was diagnosed with led to sort of a downward spiral of needing more serious interventions, such as um, med changes, like trauma focused therapy, whatever the case may be. And because of the um, trauma and increased strain that I was under, I had to resort to more and more focused and critical coping mechanisms, such as the TIPS, TIPP coping mechanism, uh, self-soothing touch, all sorts of different coping mechanisms. And At a certain point, they just stopped working for me. So I had originally gone to my therapist and my psychiatrist, and I said, "Hey, I need some help. I want to focus on this and really get this working." But of course, everything in outpatient takes forever, and they weren't able to get me in soon enough to be able to stop me from potentially hurting myself or committing suicide and or attempting to commit suicide. And so I realized that things were a little bit more drastic than what they were able to do for me. So in the Duluth Superior area, we have quite a few good mental health resources. The Human Development Center has a crisis line that I utilized, but the main place that I wanted to go was Birch Tree, which is a crisis intervention center. It is a locked facility, but you're not stuck there. You can discharge at any time. They have a psychiatric advanced practicing nurse on staff who is able to change meds, prescribe meds as need be, things like that. And they have a really solid team of staff there who are able to keep you safe, check in on you, do groups talking about different situations, teach coping skills. Generally, just a really good, safe space if you are not feeling safe alone, if you're not feeling safe in your own home, things like that. So that was my original goal, was to go there. And I didn't know the process, so for any of you who are in the Duluth area who need some assistance, you'll wanna first call the crisis line, which, let's see, I have the number here. So the crisis line number is, this one. The crisis line number is, 1-844-772-4724. And I highly recommend that you give them a call if you are in a mental health crisis. They are wonderful, super sweet, able to get you the help that you need, develop safety plans, get you an assessment so that you can go and utilize any of these facilities. Um, Once they do that assessment, then they can send it off to Birch Tree, and Birch Tree will kind of make the decision if they want to, um, if they'll admit you. So I didn't know this. So I went to Birch Tree, and they were super helpful there, everything, let me inside and, were trying to keep me calm and everything, but they were like, "We don't have any beds, and also you need an assessment." So they called the crisis line for me. I talked with the person. We developed a safety plan, which involved me staying with my girlfriend at her parents' house, where I'd be a little bit safer than on my own at my apartment and to check in and do an assessment the next day. So I ended up going to my girlfriend's that night, staying with her and her parents, who are lovely. And the next day, the HDC, the Development Center, came to my girlfriend's house, and we did a quick assessment where a nurse, took my information, did asked some pointed questions like, "Are you currently having any suicidal ideation, intrusive thoughts? What are you feeling?" Rate your anxiety, depression on a scale of 0 to 10, things like that. So after that meeting, she put in that assessment and then sent that off to Birch Tree. Birch Tree didn't end up having any beds open for another 2 or 3 days, I think. So I was actually stuck at my girlfriend's house for a couple days longer than what had originally planned, but that was okay. I didn't do any self harm, didn't try and commit suicide, anything like that. So after the after those couple days that I was with my girlfriend, I ended up going to Birch Tree. They got me a bed. I was able to go and sit and, get go through their intake process, which was really thorough. They go through your belongings that you bring with you, take out anything that could be um, could be harmful or dangerous that you could have. So they took my belt, they took my purse, and they took my phone charger and a razor, I believe is what they all took from me. So they take a lot of stuff from you, but you're not without that. Like, you can go and ask to check it out. So say I wanted to shave, they would, I could go and check out a razor, and they just make sure to keep updated and make sure that I was doing okay. They do hourly safety checks, so They come by, knock on your door, come in, take a look, see if you're okay. Um, they do groups, like I was saying. They have a bunch of resources. Staff are everywhere. They are super helpful. But it wasn't the safest space for me, especially going through intrusive thoughts and extreme suicidal ideations. So I ended up not being able to stay there. One of the nurses came in later that evening, and pretty much since the time that I was in my room, I was having constant panic attacks, breaking down all the time, crying, couldn't get comfortable in the space, couldn't feel like myself. So one of the nurses came in and we had a quick chat, and I'd recognized her. We used to work together as colleagues. And she kind of was able to draw out my rational side of my brain and, the EMS trained, the side of me that tells me that I'm able to, do thorough emergency assessments on people. And I was able to do a quick assessment on myself and realize that, yeah, I was actually extremely high risk. With the amount of suicidal ideation that I was have, intrusive thoughts, had I had any more resources, less supervision, I don't doubt that I wouldn't be here being able to give this video essay, whatever you want to call it. So we made a decision together to end up sending me to the ER. Now, the main problem with that is that I the emergency room was my last option. I work in EMS. That was going to be the last option for me. I didn't want to go, and saying that I needed to go was kind of a big step for me in my care. To anybody who is having a medical emergency, mental health or otherwise, it is a fantastic place. I recommend you go. Recommend you call an ambulance if you need. But being a medical provider on the ambulance, I couldn't have my coworkers seeing me at such a state, and because of our policies, which I know, I'd have to be transported in restraints, and the last thing that I wanted to do was have my coworkers restrain me to the cot and then transport me to the emergency room. Um, how bad would that look, one of their own being transported like that? So I we developed a quick safety plan of my girlfriend would come and pick me up, and she would take me down to the ER, and thank God for her, like, I would not have been able to make it through this crisis without her. So, she took me down to the emergency room, and funny enough, I saw some of my coworkers there, but when you go into the emergency room for suicidal ideation, you are marked as the highest priority because they basically need to get you into the back and lock you down, take everything away from you, which I know sounds really scary, and I promise you it is for your own good. It is scary. It is scary having everything taken away from you, but if you don't if you don't get that help and you know that you need that help, then it's going to be worse off for you. So, I went in, had everything taken away from me. They strip you down, they put you into their own clothes. The underwear is horrible. It's like this tiny thin plastic, or not plastic, a cotton fabric. It's horrible. They put you into these like gross scrubs that are always too big for you. And just you're stuck in this room. And I probably should have had a 24-hour one-to-one, which means that there's a staff member who is watching me constantly while I'm in the emergency room. However, because they had this ward basically called the behavioral health unit, which is rooms separate from the ER in a locked like little hallway. Um, they didn't need to necessarily go that far. They had constant camera access to me. Um, and then there was a nurse like right there. So if anything did happen, they'd be able to come and help. And I was in that room for about 2 days, if I remember. So I was in that room. Um, there's not really anything Thankfully, they let me keep my stuffed animal. That was one of the things that kept me grounded was I was able to hold on to my stuffed wolf, and I was allowed to have guests while I was in the emergency room, so, or visitors. So my girlfriend was there with me the first night, um, and she was really, really helpful. Um, my dad came in at one point, and then also one of my very good friends, Tessa, also came in and visited me while I was down there. I could have books. Books were one of the things that kept me stable throughout it. I read a lot, especially in the ER, and the nurses were nice enough to lend me one of their emergency nursing textbooks that they have spread throughout, so I was able to keep grounded a little bit more that way. But for the most part, like, meals were brought to me when they were brought to me. Um, I had a wristband on for the first little bit. However, after a dissociative episode where I honestly don't remember much except for showing my nurse my bloody wrist and her cutting the wristband off, I think that I was self-harming with it, which is not typical for me. I don't generally I don't have any prior history of that. And another time, I think one of a blood pressure cuff fell off of a cart, and I had torn my arms open with that too, and so, yeah, the nurse came in and took that from me too, and I wish I remembered more of these, but I just remember seeing the healing wounds and remembering the nurse coming in and kinda interrupting whatever thought process was going on, dissociative episodes. So, you're not completely safe, to say the least, but they are right there to take care of you if you do start doing anything, if you are thinking about harming yourself, if you are harming yourself, like, they have a lot of interventions. Um, One of the things that I really, appreciated as well was the fact that, they had access to strong medications to, like, sedate me, keep me calm. So there there are 2 main ones that at least the emergency room uses. The first one is Hydroxyzine, which is a anti-anxiety medication. One of its side effects is that it can make you kinda drowsy, and that is a pretty common as you need it PRN, medication. I actually have some for outpatient, use now, especially as I'm sort of getting back into and used to society. So, with that, I'm able to keep calm and sort of lower my anxiety from an unbearable level at, like, a 10, drops it down to, like, an 8, maybe a 7 for me. The other one is called Ativan, and I'm sure that some of you have heard of this. Ativan is a fantastic medication for sedating people. Um, it is also an anti-anxiety medication, so, um, but it has a much stronger drowsy effect, where I, at least, when they gave it to me, I actually asked the nurse for it specifically because I was in a corner huddled up crying, having multiple panic attacks, and, the nurses were lovely. She came in, she asked me, "What can I do for you? Is there anything that you need?" And I basically looked at her and asked her, "Can you sedate me?" She was like, "Yep." Got me some Ativan, and I was out. Not the best sleep of my life, but at least it was something. Um, and it calmed my anxiety long enough for me to be able to focus and not dissociate or hurt myself or anything like that. So, a lot of my time in the ED was spent sleeping, reading, or eating. Um And having visitors, which was, of course, lovely. After about 2 days in this tiny room, they moved me to a different tiny room, in the ED, to a different behavioral health unit. The one that I was in was very loud. They gave me earplugs, which was nice, but, it was sort of the place where they bring everybody initially, so people who are violent, people who are disruptive, people who are suicidal like myself. This is sort of like their entry behavioral health unit. And for people like me who need a psych ward, they and who is really traumatized by what was going on outside of my door, they moved me to a quieter space where I was able to have a little bit more peace. Um, about the same size, same everything, still able to have guests and visitors, which was nice, but, it was just quieter, which was much nicer. Um, After I think it was 3 to 4 days, 3.5 days in the ER, um, transport came, and I've worked security, in the hospital setting, in the ER, and it is always something whenever you have a suicidal ideation patient, somebody who's struggling with mental health, somebody who's violent, because your immediate thought is that they are going to hurt themselves, hurt somebody else, something like that. And I'm sitting there as somebody who just wanted help. I came to the ER on my own volition. I very much just needed like a medication change and some rigorous like therapy to get me through this crisis so I could go back out and live my life. And I was not a threat to myself. They didn't let me have anything in the transport or anything. And they got this chair, like not a wheelchair, but a chair on wheels is the best way I can put it. And a transport person and a security officer. And I was like, "Are you guys serious? The security officer doesn't have anything better to do than to walk me all the way across the hospital?" Um, it I understand why they do it. I can appreciate the fact that they were willing to and able to, have somebody there, but I was also like, "I'm not going to run away, like, I want to be here." Um, I'm also not going to, like, try and hurt myself or anybody else. But I digress. Like I said, I know why they do it. I've been in that position. So, me, the security guard, and this, poor transport person were all walking while I was getting pushed in this chair to the psych ward, and, honestly, being out of that space around other people, small talk, joking, it was such a good feeling. I was able to smile again for the first time in weeks at that point. Um, Still didn't feel safe, I I wouldn't feel safe for quite a number of days later, but it was at least something to help pass a little bit more time. It's about a 5-minute walk across the entire hospital in scrubs with a security officer next to me, passing by staff and patients and visitors alike. That was an experience, I have to say. And it is such an experience going from the ER to a psych ward because in the ER, it's just you in a single room. You've got access to your nurse when generally you need it. You don't really have anything in the room to hurt yourself with or anything, but you had some like comforts and luxuries and you were able to, ask people to come and visit. So while I was in the ER, like I said, I had my stuffed animal and that was something that was really helping to keep me grounded. Well, when you go to the psych ward, they take everything away from you all over again, strip you down, make you change into different scrubs. I went from brown, which is not a flattering color, to turquoise, which was. I actually like the turquoise, and it fit a little bit better. Same terrible underwear, cotton, super thin, not really anything useful there. Um, and then grippy socks. They give you grippy socks, which is always fun. It's kind of like a grippy sock jail. You're stuck there and you're wearing grippy socks. Um, but I'm getting ahead of myself. So I went in to the psych ward. Security officer was hanging out. The transport person left. The nurses took me into a bathroom, had me stripped down. You know, they needed to make sure that I didn't have any open wounds on me. I didn't have anything like that. And to make sure that I didn't have any like medical conditions that they didn't know about previously. So they took me into the bathroom, stripped me down, and had me changed into these different scrubs. And while I was in there, they told me, "We actually can't let you have the stuffed animal on the unit." And I was like, "Are you really freaking kidding me right now? Like, the stuffed animal that has kept me from going absolutely crazy in a room by myself for, the past 3, 4 days, you're going to take that one comfort away from me now? That's kinda bullshit." But I wasn't gonna argue with them. I was there for help. I didn't think I was gonna need to be there for very long at all. So I let them take my stuffed animal. They took everything else away from me, threw it in a locker. Security waved me down with their wand again. It's like a metal detector rod, like they use at airport security. Really basic. I found it funny because they'd already done that once. So they did it again on the unit. Maybe they thought I'd taken something from the ER with me or something like that. I don't know. So after all of this, where I had 2 nurses, I had a security officer, like, the whole 9 yards in there, basically everybody just left, and I was standing there in this room with a single nurse, and we went and sat in her office, and it was a good time. She was very sweet, had sort of the similar questions that Birch Tree had previously. Current suicidal ideation, depression, anxiety, scale of 0 to 10. Are you having thoughts of hurting yourself? Are you having thoughts of killing yourself? Thoughts of hurting anybody else? Um, all those sorts of basic intake questions. She asked if I had any medical conditions, when my last bowel movement was. Pretty basic, like, you're going to be admitted into the hospital. We need to make sure that there isn't anything going seriously wrong with you, or at least not anything that we don't know about yet. That whole process took about an hour, and at this point, I think they transported me mid-afternoon, so it was getting late. It's about dinner time, and I remember eating food in the ER and it not being that great. It was pretty dry, not really anything that I really wanted to eat. All I really had was water or juice, and I'm not a huge fan of juice. So I drank a lot of water while I was in the ER. I'm on a water pill, spironolactone for hormone therapy, which makes me pee all the time. If anybody has that experience, it sucks, especially when you're drinking a bunch of water. You have to pee, I swear to God, every 5 minutes. But it was fine. Um, and that night on the psych ward, I remember the food being surprisingly better in some ways. Like, it was still bland, it was still dry, and it wasn't something that I necessarily wanted to eat, but it had a different air to it. Like, it tasted just a little bit better, like it was a little bit more fresh. So I was placed in a room by myself. There were 2 beds in a room. Some people had roommates, some people didn't. And I basically just sat down on the first bed that I asked the nurse to take everything away from me in the room. Like, I asked them to strip the beds down to nothing, take everything that was loose. Like, I didn't wanna have any access to anything, while I was in my room, because at that point, I was still extremely suicidal, and I knew that, I didn't wanna be on a psych ward. I did, the rational part of me did, but the emotional side was like, "This is going to hurt a lot," so, I was ready to end it at that point, and, the the nurse came back and took everything away from me. I slept on a bare mattress with a weighted blanket and, 2 pillows without pillowcases, and that was how I slept that first night. I think the weighted blanket was like 5 pounds too, so it wasn't even a great weighted blanket, but at least it was something solid, more solid than a regular blanket, so I couldn't hurt myself with it. Um, and I remember asking for an Ativan and just sleeping all night. Again, when you're sleeping on Ativan, it's not the best sleep ever, but it's at least sleeping and you're relaxed while you're doing it. So after that night, I remember waking up and having just a horrible, horrible time. I was still going through panic attacks. It was very loud on the unit. A lot of people were walking everywhere. I curled up on my bed, held my pillow tight to my chest because they took away my stuffed animal, and was unable to do just about anything that day. Um, at this point, I was still having really intrusive thoughts, a lot of suicidal ideation, couldn't help but think about ways to hurt myself or how to kill myself at that point, and um, the doctor came in and saw me, and the doctor's name is Dr. Fredrickson. She is a fantastic physician who works at Essentia Miller Dwan as a psychiatrist, and um, she had some pretty basic questions for me about, what are you feeling? She did a full psych evaluation, asked about my history, um, my prior diagnoses, everything like that. She also had a PA student with her, a physician's assistant, which was a fun time to see sort of her taking notes and being able to have a second person in the room. And Dr. Fredrickson and I kind of worked out a plan. She adjusted my meds, took me off of one of my meds, an SSRI, which is a selective serotonin reuptake inhibitor, which basically just means that there's more serotonin in your brain. And this was the second time that I was on one. The first one was called oh, I'm gonna forget. I think it was Prozac. And then the second one that I was on was sertraline. And I don't remember the generic name for that, but they're both SSRIs. And SSRIs, so a little bit of a medical fun fact here. So SSRIs have this really weird random effect that can affect especially people in their 20s to 25, like 20 to 25, where they basically do the opposite of what they're supposed to do. So instead of treating anxiety, treating depression, um, treating suicidal ideation, homicidal ideation, anything like that, they can actually reverse and cause increased depression, anxiety, suicidal ideation, homicidal ideation, anything like that. And I am almost certain that that is what was happening to me because I have experienced in the past suicidal ideation from a what I wanna call, like, true perspective, where it was because of an external factor or an internal factor, my gender dysphoria, that I could specifically point to and say, "This is why I am feeling suicidal. This is why I don't wanna live anymore." Like, I can point to the pain that I am experiencing and, like, why I can't do this, and, thankfully, I was able to have help then and resources to be able to keep me alive long enough to start working on that. But here, I utilized those resources and I utilized coping skills and I tried to stay as long as I could and I couldn't get rid of these thoughts. I couldn't do anything to treat it. And it was such a strange feeling going through a terrifying experience of having no control over your own brain and body. Um, Especially when you're dissociating so much. And I can't stress that enough. Like I am going by my memory, and my memory right now of this whole event is riddled with holes and inconsistencies, and I wish that I could be a, like, thorough storyteller for this, but honestly, most of it was spent with me dissociating, at least for this first part. Like, in the ER, I remember a lot of dissociation, I remember a lot of reading and then remembering what I read, but then having, like, huge stretches where I just don't remember anything. Um, the psych ward, I remember a lot more, so I'll talk a little bit more about that, but just know that, like, my story is from the perspective of basically somebody looking in and not having a lived experience, at least through the ER. Now the psych ward, so I'd been intook. I'd gone to see the doctor, we changed my meds, and she put me on a new medication, which is of a class of medications called SNRIs. So it is a serotonin norepinephrine reuptake inhibitor. So it increases the amount of serotonin and norepinephrine in the brain. And some, if you know a basic first aid, a little bit of medicine, whatever, epinephrine is also known as adrenaline, and it is what we use in EpiPens to stop anaphylaxis from allergic reactions. It is also used to treat cardiac arrest. Um, so it's really important, and your brain uses norepinephrine, which is a different variant of epinephrine to do different certain brain functions. Now, I'm no expert on neuroscience, on psychiatry. I am talking as somebody who has basic medical knowledge and experience, and who really likes to read about medications and study her own, psychiatric illnesses, all illnesses that she has. So, this SNRI is called Pristique. SNRIs have a very challenging side effect, where you can go through extreme withdrawals if you don't take them, um, within a certain time frame of each other. So, Pristique is supposed to have less of those side effects than the generic version that the doctor and I were originally talking about, but it helps with anxiety, depression, PTSD, um, a couple of other things. It helps with menstrual, like bleeding and cramps. It acts as a blood thinner in the similar way that like aspirin does. It's a platelet agonist. It's very fascinating. And it has just a few weird side effects. So one of those side effects is tinnitus or ringing of the ears. And I have mild tinnitus in my left ear. I played flute and I played piccolo, and I think I damaged my eardrum on my left side um, throughout years of playing instruments and listening to loud music or whatever. Because I've had ringing in my ear for 5 years now, something like that, and it's not frequent. Like it just comes, and then I can't hear anything, and then like a couple seconds later, it's gone, and my hearing is back to being just fine. The same thing was starting to happen with my right side now, and that was not normal for me. So I was like, well, I wonder what this could be. Could it be a side effect of my med? Could it be like I'm having this latent tinnitus starting to happen now after a damage? Like, what could it be? Well, after reading the information about Pristique, it is listed in the side effects that I can cause that. So I wasn't too concerned. It's probably just the Pristique, nothing more than that. Remember that because we'll get back to it. So she started me out at a low dose so that we could increase to the therapeutic dose. And at this point, I was feeling much better. I had been off of sertraline. I wasn't having any more suicidal ideation, no more intrusive thoughts, at least no more than usual. And I was feeling like myself, like more like myself than I had in months. So I went to my nurses and I was like, hey, I'm feeling much better. I'd like to discharge soon. And when you do that, there's a process where technically, if you fill out the paperwork, you give the doctor 12 hours to respond. And the doctor can either place you on a 72-hour hold, which means that you are um, being held against your will because it is medically necessary, determined by a physician that you have seen. And you have like, the doctor has like 12 hours to come and see you and like assess you and everything like that. They can put you in commitment, which requires two physicians. And that basically means that you are being held against your will indefinitely until it is deemed medically necessary or unnecessary at that point. Or they can release you and discharge you. So I didn't fill out any of that paperwork. I just said to my nurses, hey, I'm wanting to discharge soon. Can we get this process started? Cut to the next day. By the way, going back to the food was amazing on the unit. You got to choose what you wanted. I had hot chocolate with every meal. It was delicious. Off topic, I know, but I mentioned it earlier and I just had to say something because the food was honestly very good. So this is my second or third day on the unit. Um, the first couple days I really didn't remember that much. Again, I think I was still dissociating a lot at that point, and I hadn't really had a chance to have my meds changed yet. So the doctor came and saw me, and she said, "Hey, I hear that you're wanting to discharge." And at this point, it was Wednesday at 12:45, and I know that specifically because she said, "I don't think that you are ready to leave the unit yet. We just changed your meds. I want to watch you for a little while, make sure that you are going to be totally okay." And I was like, "Okay, that makes sense. I'm disappointed, but I understand." So she was like, "I'm going to put you on a 72-hour hold." Now 72-hour holds only count for work days, basically. So Monday through Friday, not weekday or not weekends and not holidays. Well, it was a fucking Wednesday. So on Monday at 12:45 would be when my hold was up, which means that I was pretty much placed on a 120-day hold and not a 72-hour hold. Um, but I digress. So the doctor had placed me on this hold, and I was basically trapped on the unit at this point. I was a recluse to my room. I stayed away from a lot of people. Really, I just wanted time to be by myself, think about leaving. I stared out the window for hours looking at the outside world, wanting to go out and breathe like a breath of fresh air. Imagine at this point I'd been in the ER for almost a week. Or I'd been in the ER for 4 days, and then I just got to the unit and it'd been a week at this point since I had first started feeling like I was in crisis and in the hospital for that. So further days ahead of that was when I really needed immediate help. And I was being stuck there after feeling good. So I was upset as you would be, but there was nothing I could do. So I was just stuck there, and um the staff were very sweet. My nurses were fantastic. Um, you know, they're so used to dealing with people who need help, don't necessarily know how to ask for help, things like that. So when they get somebody who asked for help, got the help that they need, and are feeling much better, but are now placed on a 72-hour hold, it's kind of a different experience because I am like, I don't actually need any of the services that you guys provide. I don't need to go to groups to talk about coping skills because I utilize all of them and I know all of them. I don't need to go to groups to talk about my feelings because I don't want to. Like, that feels like it would be more anxiety producing than it would be helpful. Um, and honestly, I just wanted to read. Like, in about a day and a half span, I read 3 to 4 novels. Like, I think it was, I read The Fellowship of the Ring, uh, the first book of the Witcher series, Harry Potter, and read an ADHD, like, textbook self-help book kinda deal, and that was all in the span of, like, a day and a half. Like, slept for like 8 hours in the night, but for the most part, like, I just stayed in my room and read and read and read and read. And when you do that, the staff think that you are depressed. And I was feeling just fine. I was at my baseline, like, I was feeling, like I normally do on a day-to-day basis, and all I wanted to do was read because I didn't wanna be on the unit anymore. So the nurse came in and she was like, "Hey, I see that you're here. You're trying to kill time. Do you just want to like go out and go to a group?" And I was like, "Absolutely not. That sounds horrible. Please just let me be." Well, then, so you've got nurses and you've got staff, and the staff came in, and at this day, I think I had a woman named Shy. She was very sweet, and she was like, "Are you sure I can't get you anything? You don't wanna go out to a group, you don't wanna go exercise, you don't wanna, like, do something?" And I was like, "No, honestly, all I wanna do is leave. I wanna read." So I stayed in my room, and I was a recluse, and I think I left the room maybe 3 times a day, 4 times a day, um, you know, use the bathroom, shower, uh, go grab a glass of water, pick up food. Maybe it was more like 6 times a day, but really I didn't leave that much. And, it's kind of infuriating, the ward, like the psych ward, because you lose all independence. You can't use the bathroom you can't use the bathroom by yourself. You have to have a staff member open up the bathroom for you. You have to ask them to grab you shower stuff, like new scrubs, towels, conditioner. I swear to God. they give you a tiny cup of conditioner. It is literally, like, this big, and they expect me, luscious hair and all, to use that on my whole head. Are you fucking kidding me? Um, there were a few staff who were a little bit more generous and got, like, a glass of conditioner, like, basically a bottle, but, yeah, no, some staff were super stingy, and the cup was about this big. It's like those, ketchup cups that, like, you see at fast food restaurants where it's, like, the pump where you pump your own ketchup or mustard or whatever. It's that tiny paper little thing, and I had some staff members who just filled it, like, halfway up for me and this amount of hair. When I got in the shower and looked at that, there were times where I wanted to scream. Um, but in some ways it was good too. Not like the shower stuff. The showers were fine, but I was able to focus more on my health, so I was able to start developing good habits. I This might come as a shock to some, discuss some others. I am sorry, but I suck at brushing my teeth. I always have. It is a habit that I refused to do as a child, and now as an adult regret, um, but have tried to work on. And it was really helpful to be in the psych unit because what else was I going to do? Like, I didn't have anything else to distract me. I didn't have any other obligations. So spending 2 minutes brushing my teeth twice a day didn't seem that bad, you know? It was something to do. The same goes for, like, making my bed. Like, I these are things that I've carried over into my daily life now where I will make the bed every morning. And it's not because, like, I didn't want to do that before, it was just a struggle to do that before. Um, and part of that is also due to my undiagnosed ADHD, um, which the Prestique was helpful in treating. But most of the time after being placed on the hold was a lot of just waiting, just fucking waiting, and not having really anything to do. They had phones. The phones were about 10-minute long calls, so I called my girlfriend, Emmy, quite a few times. I called her mom, ironically, quite a lot because, her mom was a really useful resource for me. Called my dad, called my friend Tessa. Like, I called a lot of really important people to me, and I tried to do that pretty much every day because otherwise it would get really boring. Also, sorry about the weird camera stuff, I don't know what that's about, so other than keeping myself busy on the unit, I was basically just waiting. And thank God, in that time of waiting, I didn't have a relapse of suicidal ideation, didn't really have any side effects from my meds, um, and was just able to, like, keep calm and didn't need my PRN, didn't need, the medications that would have basically shown the doctor that I needed to stay longer, and not to say that there's anything wrong with that, not to say that there's anything wrong with being on a psych ward, with being with needing that help, with needing to stay on a psych ward for a long time. Nothing is wrong with that at all. am so thankful that we have that as a resource for people. But for me, I just wanted to get back out and live my goddamn life. um, I was stressed about work and about life and everything. Other than those few people, I basically told work, "Hey, I'm going to a crisis center. Like, I need some time for mental health." And later that day, they took my phone away, and I didn't have my phone for 2 weeks. Imagine being without your phone for 2 weeks. I turned my phone on after I got out and had messages going for 3 hours. My phone did not stop vibrating for 3 goddamn hours. So, on the last day before I left, that was Sunday, um, The doctor came in, we had a quick chat. She was like, "Any side effects, anything like that?" I was like, "Nope, I'm good to go. I just wanna leave." And she was like, "Okay, I'll put in the discharge orders for you." So, she put in the discharge orders that night. It took until the next morning to have things kind of moving and whatever, and my girlfriend, Emmy, who was supposed to be my ride, had my keys, had everything, was going to have class at 10 that day. And I was like, "Well, I need to be discharged before 10 because I don't wanna stay here any longer than I have to." And so working it out, they literally got me out of the psych ward at 10 when Emmy had class. There was no way that she was gonna be able to come pick me up. I was furious. Like, everything that they were doing was slowed down by something or another, and it was just utter and complete bullshit. So I had to rework my plans. Instead of Emmy coming and pick me up, I would go to Emmy. They gave me a taxi voucher, and I took a taxi up to UMD, where Emmy goes to school, and I was able to find a spot and just kind of work through my phone, getting through messages, rebuilding my life, and reintegrating into society in some ways. I ended up taking my hydroxyzine, my PRN anxiety med, just because it was so much coming back and living in a world where there are people around you who aren't wearing scrubs, who are just living their daily lives. It's really overwhelming, especially to somebody who's been locked in a locked facility for 2 weeks. So, while I was at UMD, I saw a couple of my friends, who go there, had a chance to just, like, tell them a quick story. Basically, what I'm telling you guys in a much shorter amount of time and a much, faster, more concise story, and I was able to talk to my bosses and figure out what needed to happen. I was able to, say, "Hey, I just got out of the hospital, like, I'm so sorry about everything that was happening. If there's anything that you need from me, feel free, but I need to take some more time off." And I was able to get my life back on track. Uh, After that, I came home to my apartment here, where I found that, and I've been told, but the supports, my father, Tessa, Emmy, had all come through and had cleaned up my apartment, had reorganized it in the best way that they could to make it more like a space that I wanted to live in, something better for me. Uh, and it is such an interesting experience being in that space, feeling like you are in a space that is yours, uh, and clean. Because what what they don't tell you when you have a mental illness is that it can be just as, if not more debilitating than some physical illnesses, you know? You have a broken leg. Yeah, you're not gonna be able to walk on it. You're gonna need to keep it elevated, ice packs, whatever. But you can still find joy in what you're doing. You can still play video games. You can still read books. You can still do those things that you enjoy. With a mental illness, sometimes you just can't move. Like there were days where I would spend a whole day in bed because I just couldn't physically move. And it wasn't like I had just broken down all of a sudden and, "Oh, no, all of my limbs were broken." Like, no. It was like my body would not listen to the signals that my brain was trying to tell it to move, and it wasn't even like my brain was listening to me trying to tell it to move. And when you're dealing with that and every single day is a struggle to just get yourself out of bed, your life can really fall apart pretty quickly. So my apartment was a disaster. I hated it. I tried to work on it all the time and I just didn't have the energy. I didn't have the focus. I didn't have anything to be able to help me. So coming home to a clean apartment that is reorganized to be able to have that help that you needed was honestly one of the best feelings of my life. I almost cried. I was able to feel comfortable and want to be in the space that was supposed to be mine. And, it's still sort of a work in progress. I've got a ladder back there. There's some bins off to the side here that need to go to storage and everything, but it's a space that I want. I've got a couch. I didn't have that before. I've rearranged so that it's much better suited for my living situation, and I don't worry about I don't worry about a mess. I don't worry about cleaning every day, like, any more than just the basic necessities, like doing dishes or doing a quick sweep of the bathroom or something like that, like, it's an interesting feeling, especially coming from such a struggle, uh, with my mental health. So all of that was on Monday. Monday's when I got out. And we decided, my girlfriend and I, who is staying with me, at least for a little while here, keeping me safe, making sure that I'm not going to hurt myself or anything. Um, we decided that we want to have like a game night, have my friend Tessa over. We'd order pizza, and just chillax, relax, you know, enjoy being out and about from the psych ward again. So we had pizza. I got ice cream cake. Man, when you are in a ward for 2 weeks, you think about the weirdest things, and the one thing that I really was craving was ice cream cake, so we got a giant ice cream cake. Had my friend Tessa over, we were playing games, and suddenly in the middle of our game, my whole right side of my body went numb, and it was really weird, and I had a ringing in my ear, and I couldn't place it. And, I'm a trained EMS worker, so when you suddenly have one-sided weakness and numbing, your brain goes to stroke. And I I did a quick Cincinnati stroke assessment, and it, screened negative, like, I didn't have any arm drift, wasn't having facial droop, wasn't slurring my words, anything like that, so I was like, "Well, okay, this is weird." Um, and I originally wasn't gonna go in, like, that night. I was just gonna wait until the next day, go into urgent care, talk about it there, but, I wanted a second opinion, especially because I was just out of the hospital, and I didn't know, like, if I trusted myself necessarily, so I called the nurse online, and very sweet, she basically said, "I can't diagnose you here. Um, it sounds like you might be having a stroke. You should go in." And I was like, "Yeah, you're probably right." So I went into the ER, and mind you, I'd just gotten out of the hospital. The last thing I wanted to do was be admitted back into the hospital, but I also wanted to make sure that I wasn't going to die because that was basically what I just spent the last 2 weeks preventing anyway. So, my girlfriend and I were out in the waiting room for 2 hours, something like that, waiting for a bed to open up. Apparently, they had, like, 40 patients prior to us arriving, which was typical, but also insane, and, I was sitting there, couldn't feel one side of my body, had pins and needles all over the place, and was just, stressing out, wanting to just know if I was, like, bleeding out or what was happening. And we get back, and we are just waiting to see the doctor. It, at this point, has been 2 hours in the waiting room, another hour and a half in a room in the back. I was exhausted, we were both exhausted, it was, like, by God, fucking 2:30 in the morning on the day that I got out. And the doctor comes in, and it's a doctor who I know very well. His name is Dr. Wyatt. He's fantastic. We had a quick chat, and he was like, "What's going on?" Described my symptoms to him, and um, I was like, "I think this is my medication, Prestige. Like, I've read about the side effects. I know that right-sided I know that ringing in the ears, tinnitus is a common side effect. I'm having that with this right-sided weakness." And he was like, "I don't disagree with you. I'm gonna talk to my psychiatrist friend." Got a second opinion from a psychiatrist friend, and apparently, Pristiq, the medication that I was on, is not a very common medication to start somebody on when you start them on SNRIs. And the, side effect that I was having was extremely rare, 1% of the population, or less than 1% of the population that they had tested for it had shown this specific, side effect, and it was so rare that I actually didn't even read about it in the notes that I had, it's not a very common side effect, and I was totally spot on with my guess. It was absolutely that. um They took me off the medication, have me on something else, it's working just fine, um, and I'm not having those weird, nasty side effects anymore. But I tell you, it was so scary going back into the ER after having been locked away in a hospital for 2 weeks prior, or thinking that you were gonna die from a stroke, that's also pretty terrifying, so, um, overall, it's been a wild fucking 2 weeks, and I'm excited to be back. Um, Hopefully, if everything goes well, um, there'll be a new episode of The Transgender coming out. Um, I'm working on some cool creative projects right now, so keep an lookout for that on Instagram. If you're watching the live stream or watch this pretty soon after the video comes out, um, you can look forward to some of those creative projects coming out, hopefully within the next months or so, depending on how much time I get. And then also new episodes of The Transgender coming out weekly Wednesdays. Um, so just keep a lookout on your stream. You can check me out on Instagram. I'm at aliana.kruger. You can check out the Transgender Pod on Instagram. Honestly, I appreciate you guys. That post that I made a couple of weeks ago about needing some time for mental health got so much response, and I can't thank everybody enough for that. Leaving to such nice fanfare was such an experience, and I can't thank you guys enough for that. So I really appreciate it. I wanted to be back every day. I thought about making this video. I thought about recording the next goddamn episode of the podcast, and I thought about you guys. You guys are really important, and I thank you for all of your support. And know that I'm here to stay. There's nothing gonna happen to me. And if you have any questions, concerns, feel free to comment on this video, send us a direct message, send me a direct message. Otherwise, you can also email um, at transgenderpod or to transgenderpod@gmail.com. So, or questions at transgenderpod.com. That's what it is. Questions at transgenderpod.com. You'd think I know this having done a podcast now for however long, but I thank you all. I'm going to log off now, and I hope that you all have a lovely day. I love you all, except the bigots.